In this segment, we're going to treat thoracic somatic dysfunction using counterstrain technique. And to find the associated tender point, we can palpate in the midline, but typically we have tender points just off the inferolateral tips of the spinous process. So we come in from a 45-degree angle and press from lateral to medial and up on a 45 to elicit the tender point. And here on the right side, we have a hypertonic area, and when I press, the patient says that's tender, so we're going to quantify that as a 10, and we're going to find the position to totally or completely alleviate that tender point, which classically is going to have to require some rotation away and side bending away. So first we're going to have our patient have her head rotated away. We're going to bring the arm up to help induce some side bending away, and several ways to control the patient. We can come on top of the shoulder. We could actually even put the patient's arm on their back, and then we can slowly add extension and rotation away, and then pull down on the shoulder, and you get softening of the tissue under your finger. So the classic position to alleviate this tender point is going to require extension, rotation away, and side bending away. In this case, when we have a tender point off the inferior lateral tip on the right, and we hold this, get the position of optimal comfort, hold for 90 seconds. After 90 seconds, I'm going to slowly put the patient back to neutral and then reassess the tender point, and hopefully the patient says it's 0 or as close to 0 as possible, but at least 70% reduction of the initial tenderness.